Hey, what's going on, guys? Welcome to this episode of the Silencing Podcast. It's your host, Adam Tunji, back at you guys again and with another episode. And today I'm with my man, Paul. Paul, what's going on? Thank you so much for hopping on the show here today.
Hey, thank you for inviting me on the show. I'm excited to share some things.
Hey, I'm looking forward to it, man. And so, first question: how can I get nice ass hair like that? What's the secret?
Then you got to just you got to work on really hard projects.
I love it, man. Can you tell us a little bit about yourself? I know you're currently the CIO for Regional West Health Services, but if you kind of give us a little bit of background about who you are, get the audience warmed up, and we'll kind of get this kicked off.
Yeah, sure. So my background has been mostly actually in consulting. I started out with Deloitte Consulting back in the day, and then worked for a number of years with a kind of a boutique consulting spinoff with some ex-Deloitte partners. And so saw a lot of different firms, did a lot of different work for different types of healthcare firms. And in the last few years, basically one thing led to another and went out on my own and sort of the CIO contract business, not really interim, but doing, more hard projects.
Nice.
And we've been impacted this year by the Change Healthcare cyber attack. And I noticed that it didn't really hit the news like I thought it would, with all of the drama and the extent of the impact. And so I thought that your audience might be interested in hearing some of the backstory about that.
Yes, please. Just dive right in. Get us started. Tell
Okay.
us all about
So it's already been 6 months. Back in February of this year, it started out very innocuously. On February 17th, a little application called Screen Connect, which is remote help desk software. It's this stupid, simple little application, put out a notice on the internet that there was a terrible vulnerability in their software and they had a patch for it. We had it at our hospital. I'm currently a CIO at Regional West. And so we applied the patch right away because the vulnerability was bad. And you're going to find out how bad it is in a moment here. But Change Healthcare did not apply the patch for like 4 or 5 days. And so on February 21st, they got hacked because what happens when these vulnerabilities get published on the internet, the good guys apply the patches, but the bad guys are looking for those vulnerabilities to see what kind of trouble they can get into. And so what happened is if you don't apply the patch, somebody can get into your system and grant themselves admission or administrative privileges. And so what they did is they got in, and Change Healthcare is a huge company. They're a major clearinghouse for thousands of hospitals and almost 1 million physicians. I mean, the footprint is just huge. And so they got into their main data center and granted themselves administrative rights, and then proceeded to encrypt the entire data center.
Oh my God.
And the worst thing was Change Healthcare had no intrusion detection. They didn't know what was happening. They just noticed that their application started going down. So there was two problems. They didn't apply a simple patch, and they didn't have any kind of intrusion detection system to kind of keep these guys out from finishing doing what they were doing. So Change Healthcare runs a big clearinghouse that we use, and maybe I don't know how many thousand hospitals use it. But in the healthcare business, you have to go through these clearinghouses to get your claims out to the insurance parties. And so it's essential money that hospitals need to keep running. And all that went down. And you can only have one clearinghouse. So a lot of people had been on Change Healthcare for that function. They had that. They also had pharmacy applications. So what you saw in the news when this went down was that most of the news was about the people that couldn't get their prescriptions refilled. Because from a consumer standpoint, that was sort of what was interesting. What
Oh, was
wasn't
that the like whole Adderall shortage? Did that have anything to do with that? or no? Do you know what
It
I'm talking
it
about?
that might have been a shortage anyways
Oh, okay.
before
Because like
this had
earlier this year, I
started.
remember like because I just know this because some of my friends are on Adderall and they're like,
Yeah.
"Oh, I can't get my prescription anymore," and I'm like, "Oh, what's happening?"
Yeah, it may have contributed it to I don't remember that specifically, but there were a lot of medications that they couldn't get because the systems were down.
Hmm.
So they had like 100, 130 applications. It was not trivial. It was huge. So the and right away the FBI stepped in. I think that's why it's not more widely known. The FBI, I think, told them not to communicate because we were on these internal calls since we were customers, and they didn't say anything about when they'd be back up. They just said they were working on the problem. They didn't say if they're going to pay off the group. It was called Black Hat that had made a Bitcoin demand. The rumor was it was 22 million. They never admitted to any of this stuff. So news reporters already, it's hard to understand the healthcare revenue cycle piece because it's pretty complicated compared to non-healthcare business. And so it wasn't really reported very extensively. And then the FBI put the lid on it because this is a big deal. I mean, this is a systemic risk to the United States. And so we were working for the better part of a month to try to understand when we get our systems back. And we eventually left Change Healthcare. But on the dark web, this Black Hat group began posting and saying, hey, we're demanding 22 million. We've taken 6 terabytes. This is exfiltration. So they actually take it from the servers into their organization. They were threatening to sell it on the dark web. And we're talking about maybe 1/3 of the population of the United States was on those servers. And all of their medical records, insurance records, dental records, demographic information, social security numbers, email addresses. So likely a lot of people that are listening to your podcast actually have been breached, but they may not have received any notice yet. So it's required by law that within 60 days that you notify in the event of a breach like this, all of the patients that are and customers that are affected. But they didn't do that. I mean, it so messed them up. They couldn't get they even paid the 22 million in Bitcoin, but the unencryption key wasn't provided to them. So they couldn't get their data back. They couldn't get their applications back. They had to rebuild everything from scratch. It was a real nightmare for a lot of people. And the 6 terabytes was real. They couldn't even have any way of validating whether they took that much data. So I mean, the moral of the story here is obviously there needs to be some regulation because this is a huge vulnerability in the U.S. and it isn't widely known among people in general public because the FBI put the lid down on it. And there's still, I think most of the people in the U.S. have not been notified in spite of the 60-day rules now 6 months later, and the notices, to my knowledge, have not gone out.
It's why do you? I mean, so you're thinking? I mean, like, so like the CrowdStrike issue is pretty freaking out there, you know.
Yeah,
So
yeah.
I mean, and
CrowdStrike
that
is
seemed like to be a pretty big problem too, because like airports went down, a lot of sensitive information. I mean, there was no hacks. I guess that's why it wasn't like embarrassing for the government.
Yeah, that was a very different situation. It was another rookie mistake where they simply didn't test the software before deploying it. It's amazing that more things like this don't happen. But I think in the lesson here in this case is that first of all, the bad guys are winning the cyber war because the hacks are just becoming more and more numerous. If you haven't gotten notice from your bank or credit card provider that somebody got access to a bunch of the data, then you're lucky.
Do
The
you
other
think
thing, go
not
ahead.
to, not to cut you off here, but do you think there's like a reality where someone's data hasn't been compromised already at this point of life?
Yeah, well, this is some practical advice. So if you're running a data center, keep your systems patched because the vulnerability. I mean, this is like data center operations 101. And for a system, they should have, I don't know what they did with the cybersecurity guy, but they should have tossed him out day one. And this is why you see big cloud providers like Microsoft's Azure and AWS and those kinds of systems are very, very professionally run, and they patch everything right away because they're required to get the kinds of certifications for running the kinds of things they do for everybody from Defense Department to healthcare to very highly regulated industries. And so but healthcare, this organization is very old school. They don't run it according to cloud principles. And so without having more inside information, is really difficult to say what else they could have done, except we know that they didn't do their patching. And then the other thing that is wise for us to do is something called multi-factor authentication. This is where, like, it used to be you want to get into your bank online, you just type in your password, you go in, but they say, hey, do you want to have a second approval process? You should always say yes to that. Right? Because where they we'll send a text message to your phone, or we'll send you an email, and it takes longer to sign in, but at least nobody else is signing in because they're sending it to your phone or your email. And so that's very safe. And that's essentially what the data centers need to do with all of their systems too. It's called multi-factor authentication, and it's going to be part of our life in order to stop this right now. So the breaches are unfortunately not going to go away. They're going to probably get worse until we adopt some of these countermeasures.
It's interesting because you think the healthcare world should be like on top of this stuff.
They should be, yeah. And
Yeah.
so I don't know that Congress knows how to deal with this. Yeah, because they don't understand it. And I think whenever you come up with new regulation like this, it's very complicated,
Mm.
and you have different regulators that want to weigh in it. You got the feds, you got Center for Medicaid Studies, CMS. You got all these different players that are federal and state players want to weigh in. And unfortunately, in our current system, it takes a while to develop regs. But so at the end of the day, though, what actually happened is about 5,000 hospitals were hit, maybe 30,000 pharmacies, hundreds of laboratories, and almost 1 million physicians. And a lot of them got put out of business. And we can't find the statistics on that either, because you literally could not submit a claim to an insurance company and get paid because of this restriction. So many hospitals went an entire month without any income. And a lot of hospitals are not running that deep in cash. And so it's been a big deal, especially the smaller clinics. So many of them have gone belling up, and then one of the statements we heard online when we were on a call was that many of these physicians' clinics only have 5 days cash on hand. It's like, it's no way to run a business. It's like crazy. So yeah, things have got to change, but it's put healthcare in the United States on notice that we're going to be a big target, just like the utilities and some of the other things where the feds are concerned, where we might be targeted by other state actors.
I love it, Paul. Thank you. I mean, I don't love the situation, but I love the inside the information.
Yeah.
I appreciate the start. I mean, this has been like super valuable and insightful. I mean, I think it's important to spread information like this out because I mean, even for the end consumer, because so I asked, like, do you even think there's a reality out there where someone's walking this world and their data hasn't been compromised already? Because, like,
Yeah. And so, in fact, just a few days ago, I got a call from one of my banks that says, hey, did you apply for credit? I go, no. As well, somebody's got your social security number and they're applying for credit out of Dallas. I said, I don't know anybody in Dallas. And so they said, they passed me on to the credit bureau. Many people have had this experience. I'm not the only guy.
yeah, yeah.
And they said, well, what you can do is you got to call the 3 credit bureaus, Equifax and TransUnion, and I forget the third one. But it says, hey, you can have them freeze your social security number. They call it red tagging,
Yes.
so that nobody can apply for
Yes.
credit with your social. Is that will stop the you. And then when you want to like apply for, I don't know, mortgage or car loan, you just call them up and have them unfreeze it. He says, but
Yeah.
that is the safest way to protect your money these days. He says, otherwise they could do just about anything with your social if they could get other, you know, identification stolen. They can go in and try to be you.
Yeah.
Even,
No, I've done that with my social security. So
yeah.
my stuff is frozen every time I go and they try to pull like my credit file that comes back with an error and they need like extra identification. Funny enough, actually, last time I went to a dealership to get a car for my wife and I forgot the identification information. They're like, "Oh, what was the last phone number that you had?" And I'm like, "God damn it, I don't know. Like, I don't remember." I
Yeah.
sat there for like 10 minutes and the timer was going down. And the manager was like, "Hey, you need to like answer this question." I was just like, "I'm just gonna guess." I got it right, but no, that stuff does very much work because nobody can pull out your information without them double checking certain things that only you are gonna know about your life. So
Exactly. So that's
yeah,
a foolproof way to lock yourself down and be safe. I wish it was that easy for the rest of the country and the corporations these guys are targeting. But until we get a better way, you gotta take care of yourself and make sure that you're buttoned up against this kind of thing.
very true,
So,
very true. Or Paul, where can people find you online if they want to connect with you and touch base?
well, I'm on LinkedIn. So I would suggest going on LinkedIn and connecting with me there. That's probably the best way to do that. Paul Butler,
Okay.
Butler, and I'd be happy to connect with anybody from your show.
Awesome. Awesome. Well, thank you so
Okay.
much for hopping on. Yeah. And for everybody that's watching, I hope you guys enjoyed. If you guys did, please remember to leave a like, comment, and subscribe for more content. And we'll see you guys in the next episode. All right. Have a
Okay.
good day.